Knee osteoarthritis is a disease process which is typically defined by x-rays, and we can often see that the joint is starting to narrow. What that means is the bones are getting closer together because the cartilage that lives between the bones that protects our bones is beginning to wear. And generally what happens is people will experience some pain with an activity. Maybe they go for a hike and overdo it, or they're doing their normal activity, but now the tread on their tire is a little worn, so they start to feel it. Those are serious health and well-being implications, not to mention that it can hurt, and nobody really likes that. ISA, this implantable shock absorber, is fundamentally extrapolated the brace concept to an implantable device that then takes the load of gravity and dissipates it by around 30%. If you imagine a mountain bike shock absorber, the whole thing's about the size of your pinky finger, and it's anchored, if you will, secured to the bone with a typical plate system, very similar to what we would use if you had a fracture. It prevents the compression of the bones together that's normally resisted by healthy cartilage or meniscus. It's a very sound theoretical approach to helping manage this disease. And then, if you can elevate your functional capacity as a result of that, then you get healthier. So it's not just a treatment for arthritis, it's a treatment for health. So it's an ambulatory surgical procedure, meaning the patients would come in the morning and go home generally within 5 or 7 hours of checking it. And then we let folks go home and stand immediately. We don't restrict their weight bearing, and we don't restrict the amount of motion. I've heard stories from patients of returning to, some of the most intense sports, mogul skiing, kickboxing, basketball, running, triathlons. So I think that's pretty impressive. I'm a busy orthopedic surgeon. I focus on knee and cartilage injuries and early arthritis. I see many patients with this in every clinic. The patients with this disease, we haven't had really solid solutions or reliable solutions. This will allow me to do more surgery because I'll have more options. You do have an option, and that option is palatable, and the risk is low and predictable and reliable. We'll be able to treat more patients. I believe we'll be able to tackle this disease in an earlier state and preserve health, keep people working, keep people running around with their kids. I can't wait to have it in my hands more frequently to give to patients because the stories I've heard, one young woman who was inspired by this to go to nursing school and become a nurse, and now she can stand on her feet and do a 10 and 12-hour nursing shift. It kind of makes me want to cry. I mean, it's good stuff. It's why you go to med school. It's why you open the doors to your clinic.